Well, good afternoon, everyone, and welcome to the Flint Community Webinar Coronavirus, where our goal has been to provide for you a local context to this global pandemic. And as we know, it is ever changing, and we're learning more and more about it every day. This webinar today at week 126 is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. We are looking forward to this session today, and I am thankful to be your moderator today. My name is Javon Lewis, and I am the founding director of the National Center for African American Health Consciousness, along as the director of outreach for the health plan and co-director for the Healthy Flint Research Coordinating Center. We are looking forward to all of you getting good information today from our wonderful partners who've joined us every week. Many of them have been on with us for most of these 126 weeks, and I want to make sure that we appreciate today having on with us. You can put questions in the Q&A if you're needing information about the Genesee Health System, Genesee Health Plan, the City of Flint, the Greater Flint Health Coalition, University of Michigan, and more. So thank you and we even have Michigan United has joined us today to share information with you. So you are welcome to put your questions in the Q&A, and we'll be doing our best today to make sure we get those questions answered for you. In addition, we want to say that we're looking at vaccinations. And one of the key things, and Dr. Reynolds often tells us about this, vaccinate is important. So vaccinate on time. Getting those vaccines at the recommended time is the best way to protect yourself against serious illness. And so we're going to do a little bit of talk about that during National Immunization Awareness Month, which is the month of August. Today, we have a great panel for you. Some of our panelists are going to be from, of course, the city of Flint. We have Dr. Reynolds here with us, Dr. Susan Wolford. We have a special guest, Dr. Roby Shah. And then Dr. Eckert was going to be with us. She got called away, so we'll have one of her staff standing in for us. One of the things that we want to get started off today talking about is vaccinations. And so we're going to look forward to having Danielle from the health department, who is going to be representing Dr. Hackett, but I'd also like to invite Dr. Reynolds to certainly be a part of this conversation with us this morning. Danielle, hi.
Hello, everyone. I do just have a few slides on just talking. Dr. Hackett wanted me to just briefly talk about some promising data on Moderna's Omicron booster that's going to hopefully be coming out in the fall. So I can get those, if we can get those up. Yep. So in previously vaccinated and boosted participants, 1 month after receiving the booster dose of Moderna, this new Omicron vaccine, there was significantly higher neutralizing antibody responses against the Omicron subvariants, so that BA4, BA5, that we're really starting to see now. They're taking about 78.5% of all of our cases that we're seeing in the US right now. So regardless of that prior infection status or age. So very promising data on significantly higher antibody responses. We're also seeing about 1.7 times the higher levels of antibody with this booster. And that's coming out on that Moderna Omicron boost that's supposed to be coming out in the fall. There are similar side effects as the other Moderna vaccines, and that vaccine may be available as early as September 2022. So pending that FDA authorization, we're hopeful it will come out in September. We're just going to wait and see. And then according to the MMWR from July 22nd, this was for the BA2 version, so what we were mainly seeing in the spring, but it did confirm that a third vaccine dose provided additional protection against moderate and severe COVID-19 associated illness in all age groups, and a fourth dose provided additional protection in eligible adults aged greater than 50 or greater. If you've already, what this kind of means is if you've already gotten the 4th vaccine booster, then great. That's great. If you have not by now, just kind of a recommendation, you can wait for the Omicron booster. Obviously, if you don't want to get sick or want to protect the vulnerable around you, you really want to make sure that you continue to ride these kind of waves responsibly. But for now, you can wait for the Omicron booster if you've not gotten that 4th vaccine dose and you are thinking about getting it. Because you do have to wait at least 1 to 4 months after one booster to get another. So that's an important reminder. There's also medical rumors that if it has been more than 1 month and you are over 50 years old, then you will be able to get that Omicron version of that booster. So if it's been more than a month and you're over 50, you'll probably still be able to get that Omicron version, even if you got a booster about a month ago. So if you are under 50, keep an eye out to see what the supply is going to be looking like in the fall, and there's going to be more to come. So just stay tuned.
So thank you so much, Danielle. And one of the things I know, we've got the MMWR report. For some of us, we may not know what that MMWR is. So can you give us that clarity on that?
Yeah, so CDC releases these reports. They're really high, full of data, really great morbidity, mortality, weekly reports. And that's what this is. It's a very well-supported documents that come out with the latest and greatest information with them.
So we rely on getting that good information. Now, one of the reasons I'm going to ask again, Dr. Reynolds, he's always available to help us, as along with Dr. Wolford. When we look at this information, how do you suggest that we look at this information from a community perspective? Dr. Reynolds.
Well, you heard the big picture, and then we're talking ground level, what you should do. And I say it that way because we can't function as practitioners or clinicians without public health. And otherwise, you've heard me say we're like a frog in a hole in the ground. We see what's above us, but we don't know what's all around us without that assistance. Mm-hmm. And vaccination is an individual choice, but it's a public health initiative. And sometimes we get hung up on our individualism. We forget that we have people in our family, people in our school space, our workspace, people we may interact with who also benefit by us being vaccinated. So yes, it's an individual choice, but hopefully that individual choice is driven or motivated by our concern for the people around us. And you've heard me say before, every time there's a new cohort of adults having children, they forget that they had all the immunizations that we spoke about earlier. And the reason they have not seen the illnesses that these immunizations prevent is because the immunizations have been effective, but also because large numbers of people have been getting their immunizations. You know, we used to call them the back to school shots, and they still are, because that's the season. It used to be that it is still required, and actually, if a family, parents decline to have their children immunized, by law, they're required to go to the health department for an orientation about immunizations. And then there are things that follow there, but that's how important it is. Why would we take the time to do all this convincing? It's because once you get one of these conditions, it may be too late for some people. Now, we can talk about a famous senator from the state of Kentucky. He is a post-polio patient. I can talk about colleagues of mine who have had, as they got into their 60s, have had to step away from working day by day because they had post-polio complications. So it is so important that we get vaccinations when they're available. And you've heard us talk about long COVID. That these things get complicated. You've heard us talk about shingles. Now, most people say you have to be, well into your 30s, 40s, or a senior to get shingles, but I've seen young people under stress get shingles. So it's important that we get our chickenpox vaccine uh, because it has tremendous impact. Even if you survive, it has impact on the income of your household. In other words, if you have 3 children and they get chickenpox one after another, and every time you think you're clear, it's possible you may miss work or childcare for weeks if you don't have a backup plan. So immunizations are so important in our everyday life.
So as we look forward to that, there are some events that are going to be coming up that will offer immunizations across our community. I know Joanne is out there working on immunizations. We got Michigan United, and then the Genesee Health Plan is also going to have an event coming up that we'll talk about in terms of getting those multiple immunizations. So we're encouraging people to think about getting those immunizations to maintain their health and well-being. So thank you, Dr. Reynolds, for sharing. And one of the things that we wanted to do this morning, because we've got a lot we want to cover today, but one of the things we want to do, as it was requested last week, was to get a little bit more information on monkeypox. So we've learned about the vaccines and the availability of vaccines. And so now we're going to ask Dr. Susan Wolford if she would come and give us an update on monkeypox. So again, thank you, Danielle. Dr. Wolford.
Thank you so much, Yvonne. And I think I shall share my screen here. And in fact, we are going to be talking about monkeypox, but in order to really grasp the whole picture with monkeypox, we have to go way, way back and think about smallpox and vaccines. And so I'm so glad that we started off by talking about vaccines and how important they are. So we're going to go way, way back, long, long ago, and far, far away. There was a deadly disease called smallpox. And it was called small, but that was because of the little spots it caused on the body, but it had a very big impact on health around the globe. It was deadly. Out of every 3 or 4 patients who got smallpox, at least one of them would die from it. So you can see this was a horrible scourge. If a family got it, somebody in that family was likely to die from getting smallpox. So with that, the problem was they didn't know what caused it, right? So this is about before people knew what viruses were, before vaccines, before any of that. They had this really awful disease. What they understood, though, was that people who had the disease afterwards, if they survived it, they wouldn't get sick again. And so they, bright minds around the world, thought to themselves, well, if we could give people a small amount of the illness, then maybe they wouldn't get as sick and they wouldn't die. So they had this idea where, if you think of this gooey salad dressing as pus from a sore from smallpox, they would take the pus from the sore from smallpox of somebody who had smallpox and scratch the skin and introduce it into their body, or dry it out and get it into their noses. Sounds gross, right? But, that's what they did. And let me go back to sharing my screen. When they did that, they would give the person indeed a milder case of smallpox. And here you see a picture of it being done in China. As I say, this was thought about around the world. I think in parts of Africa, people thought about doing it. In Asia, this was not just in one part of the world. But when they did this, they realized that people indeed got a milder course of the disease, but still about 1 in 50 people died. So you still died. So that process was the early stages of trying to work out how to fight these illnesses. But what they also realized was that people who worked with cows didn't seem to get smallpox. And they didn't really know why, but they thought it through and realized that if people got cowpox from cows, which was a milder disease, somehow getting cowpox protected you from getting the deadly disease of smallpox. And so this is where the genius of vaccination came about. Many, many people thought about this, and Jenna is the one who often is said he thought about the milkmaids and the cows, but there were others who were aware of this idea that people who worked with cows, not just the milkmaids, but also the farmers, would get cowpox and wouldn't get smallpox. And so he tested it out and got some of the pus from the cow, inoculated a child with this, something we could never do today, and realized that the children would get mild case of cowpox and would not die because it was cowpox, because it didn't kill, and they wouldn't get smallpox either. So as a result of that brilliance, they were able to create vaccines that ultimately led to the eradication of smallpox. So now no level of politics or spin or this is clearly a fact that this way, this approach of dealing with viruses works, and we can eradicate some things by using a milder form, using something that allows you to create the antibodies and therefore fight off the infection. So by the 1980s, we had eradicated smallpox worldwide, and in fact, ultimately stopped vaccinating people against smallpox because the disease just wasn't around. Well, the reason why all of this is important is because smallpox is an orthopox virus, and monkeypox is in the same family, which is actually kind of good news, because with monkeypox, we know that it was first identified in 1958 in Central Africa, and first in a monkey, although it can be spread in many other animals, and then in humans in 1970. When it first was seen, it was mainly in Central Africa, and then by the turn of the century, it was more also seen as well, in West Africa. So the strain that is spreading around the world now is that strain that comes from West Africa. That's actually good news because it is less lethal than the one from Central Africa. The one from Central Africa might kill up to 1 in 10 people. The one from West Africa rarely ever kills anyone. And that's the one that's spreading. Also, what we know, because these viruses are related to smallpox, they're all part of that orthopox family, vaccines that were created to treat smallpox also are effective against monkeypox. And so I know I've taken a lot of time this morning and we've probably run out of time now. So we'll have to go into more detail about monkeypox in future webinars. But just to say that monkeypox, we are in a good situation with dealing with monkeypox because we have vaccines that were created that could fight related illnesses. We know they also work in monkeypox. And an interesting side note, that people who are vaccinated against smallpox may to some extent be still protected against monkeypox, even if you were vaccinated many, many, many years ago. And I was going to try to show you my smallpox vaccine scar, because if your smallpox vaccine took, you can see a little scar on your arm, but it doesn't show up well on the webinar. Otherwise, I would disrobe and show you it. But it shows that you were vaccinated against smallpox and it took, and possibly that provides some degree of protection. But we need more information about that. Particularly depends on how long ago you were vaccinated.
Well, there was a question, Dr. Wolford, and I think Dr. Reynolds, and he may want to come on as answering it. So the question is from Elder Bailey. Are they introducing a small dose of the disease into the body? Is that what it was?
So back in hundreds of years ago, when they started off vaccinating, that's a fabulous question. I am so glad you asked that, Dr. Bailey. Hundreds of years ago, when they started, they were putting the actual disease in the body, another disease, right? So, well, first of all, they started off by putting a little bit of smallpox. That was not called vaccination. That was variolation, and that is not it. What happened with vaccination was they put a small amount of the cowpox disease. The body produced antibodies to that cowpox disease. And if you had those antibodies, then you could also fight off smallpox and you would not get smallpox. You wouldn't get a severe case of smallpox. As we have moved along in vaccination, we have lots of different ways to help our body produce antibodies to a disease. So, you know, with coronavirus, what we do is we put in the instructions for making the spike protein. So our body makes the spike protein and then creates the antibodies to fight that spike protein. And so that when we then come in contact with the actual illness, we're able to fight it off. With flu, sometimes, and with other illnesses, we put in killed viruses. Sometimes we put in parts of viruses. We very, very, very rarely put in live viruses anymore. And if we do, they're very, very weakened so that they can't actually cause the disease. All they can do is help us fight it off, learn how to fight it off.
So Dr. Wolford, I'm glad you answered that, because making that link to where we are today with the COVID vaccines is it's not that practice that was before, but this is a newer practice that allows us to be much more organized in providing the vaccines for our communities today.
Absolutely. I think it's important to note that even with the most basic form of vaccination, before they knew all that we know now, they were still able to protect people and stop them from dying in the numbers that they were dying from smallpox. So today, when we have even better science and better information and processes and procedures and better ability to be hygienic in how we do this, why would we not avail ourselves of these vaccines that have had hundreds of years of science to protect us and allow ourselves to be essentially just like people before this information came about in the 1700s, when they had smallpox and could do nothing and just were at the whim of the viruses. We don't have to be at the whim of the viruses. We know more now and are able to protect ourselves better.
So thank you, Dr. Wolford. And I know sometimes people are really fearful about vaccines. And so that's why we continue to have these conversations to clarify the history versus what's going on now. And yet there's still many, many questions that people have that we need to answer. So we appreciate getting those questions in from our community. And so one of the ways, thank you, Dr. Wolford, one of the ways that we're looking at to share is many times in this world, now that we know more about public health, is that there are opportunities for us to get some additional information at no cost, actually, for public health information. Learning more about public health is really critically important. So we have today with us Roby Shaw, who is a professor at the University of Michigan, at Michigan State University in the Division of Public Health. And she helped create a course that she wants to share as a way for us to learn more about public health. Dr. Roby.
Hi, everyone. Thank you for having me. Today, I'm excited to share with you some information about a free online course that my colleagues and I developed during the height of COVID-19, back when there was still some uncertainty about how the disease was spreading and how to keep ourselves and others safe. The course is a resource that's available to anyone who's interested in learning more about public health and why it's important in the fight against COVID-19 and beyond. Next slide, please. So last year, the US Surgeon General actually issued an advisory against what is known as health misinformation. He described it as an urgent threat to public health and efforts to help stop the spread of COVID-19. Misinformation refers to false or inaccurate information that is unintentionally sent or shared. There's also disinformation, which involves the deliberate spread of false information in order to mislead people. Both types are dangerous and have perpetuated myths and conspiracy theories about the pandemic, which have put lives at risk, fueled vaccine hesitancy, perpetuated health disparities or unfair differences in health outcomes that we've seen. And both types of information only help to prolong the pandemic. On the preceding slide, there were some examples of headlines and titles right there. Yeah, thanks, from news and journal articles that showcase the severity of COVID-19 misinformation and the need to counteract it. So we can skip ahead to look at the CDC strategies that were published for addressing COVID-19 misinformation. So they include things like listening to and analyzing misinformation that's circulating through monitoring social media channels and news outlets to better understand how misinformation is spreading in your community. It's also important to engage with and listen to your community to better understand local perceptions and questions and concerns. It's important to share accurate, clear, and easy to find information about the pandemic via different channels such as the internet and community events, and to use trusted messengers like religious leaders or community organizations, groups like this one, to convey accurate information and answer those commonly asked questions. Next slide. And so as part of efforts to help combat misinformation about the pandemic and also strengthen our outreach and ties to local communities, in 2020, my colleagues and I in the Master Public Health Program at Michigan State launched a free and fully online course for the public. Next. The course is called Promoting Public Health in Michigan in the Face of COVID-19. And as shown on the next slide, the primary aim of this course is to strengthen participants' understanding of public health, what it is and why it's important in the fight against COVID-19 and beyond. You know, as we start to emerge from this pandemic, how do we take what we learned from it and apply it to address other public health priorities and crises, including tackling related racial health disparities. And so by enrolling in the course, you'll learn key public health terms. So terms like health disparities, health equity, social determinants of health. You'll learn how social and environmental factors, how things like poverty and racism drive unfair differences in health outcomes, including racial differences in COVID-19 illness and death that we've seen. And you'll also learn strategies for promoting public health in your communities. The next slide provides a summary of the topics that are covered in the course. The topics along the bottom are newer and some of them are still in development, but the current modules cover a brief history of public health, including the impacts of vaccines over the years. There's a module on how psychological, social, and environmental factors influence health. There's a module on the impacts of COVID-19 in Michigan specifically. Another module addresses how to promote a healthy society, how communities can support public health, promoting vaccine access and confidence, addressing traumatic stress through trauma-informed approaches. There's a module in development on promoting public health in rural communities and addressing social and environmental challenges, with Flint, Michigan used as a case example. So as you can see, the course covers an array of topics, some of which are more specific to COVID-19 in Michigan. But what's great about the course is that you can pick and choose which topics you want to learn about. You don't need to complete all of the modules or sections. The course is really designed for you to be able to log in and customize your learning experience so that you're accessing the information when it's convenient for you. And the next slide shows our current instructors in the course, including faculty and community experts who developed the content. Special shout out to Yvonne, who co-facilitated the module on community engagement and public health. The next slide shares some other details about the course. So as I've been saying, it's organized into specific modules or sections that cover the topics I just presented. So there's a module on vaccinations and another one on trauma, etc. Each module includes short, pre-recorded PowerPoint presentations on the topic that review the learning objectives for that particular module or the knowledge and skills that you're expected to come away with. And then the presentations themselves delve into that topic using a mix of figures and images that are presented in a user-friendly way. It's important to emphasize that this course, it's not an advanced course on public health, but is an informational resource that, again, is intended for anyone, including people with no background in these areas. There are also opportunities within the course to participate in discussion forums where you can post questions and reflections and connect with other participants and the instructors. And then for each module, you're also invited to complete a short survey about what you learned and your satisfaction with the module. Any responses you provide are anonymous and won't be used to identify you. And to thank you for completing a survey, you have the chance to receive a $5 gift card and a $25 gift card if you volunteer to participate in a short interview about your experiences in the course. We greatly value your feedback on how the course can be strengthened. The next slide. So registration for the course is free and it really only takes a couple of minutes. Step one on the next slide involves clicking on this link, which will bring you to the registration page as shown in the screenshot below. And we'll be sure to drop the link in the chat here. And then next slide, once you're on the registration page and scroll down to the bottom, you click on the green register button shown here. And finally, as shown in the next slide, in the next square, the square on the left side, you click on the green create account button and enter your contact information as shown in the right square. Next slide. Once you're registered, you can log into the course. Your homepage will look something like this. So each module or section is represented by a different block, beginning with the welcome module, which includes a short welcome video from our program director and a link to an anonymous background survey that we invite you to complete so that we can better understand who's enrolling in the course and whether we need to broaden our reach. Again, within each module or block, you'll see the PowerPoint presentations, a discussion forum, and optional feedback survey. The next slide gives a little information on who's enrolled in the course. To date, over 300 people who are mostly young adult women working in the field of healthcare in Michigan. But there are also participants who log in from other states and countries and from other fields of work. The participants so far, they're racially diverse, but have mostly identified as non-Hispanic white. So we are exploring how to diversify our audience and of course, welcome any ideas or suggestions you might have on how to do that. The next slide shows some feedback we've received from participants through surveys and course interviews. Next slide, please. Oh, looks like it skipped ahead maybe. Okay, I'm not sure what happened, but there was a slide that presented some example responses we've received from participants. So some shared great information, a refresher, the course was easy to understand. I like the visual aids used and real world examples, easy to follow. The definitions are presented in a very respectful manner. The course has taught me different ways of solving health problems, and the information is very useful for day-to-day living. But of course, as shown on this slide, there's always room for improvement and expansion. The course is an ongoing project. We'll be reviewing and updating the existing content and adding new topics. If there are any topics that you would like to see covered, please let us know. We're also exploring how to offer continuing education credit to community clinicians and other providers. And again, we're exploring how to engage a more diverse audience of both participants and instructors. So if you or anyone you know might be interested in working with us to develop and facilitate a new module, please reach out. We'd love to engage more community partners in the delivery of this information. And on the next slide, I'd like to conclude by gratefully acknowledging support for this course that we received from the Association for Psychological Science, the CDC, and the National Network to Innovate for COVID-19 and Adult Vaccine Equity. Thank you for your time today. I'll drop the link to the course in the chat, as well as my email address. Please reach out with any questions or feedback. Thanks again.
Thank you so much, Dr. Shaw. We appreciate that. I know we've had questions about how do we learn more, and in this time where things are changing so rapidly, the additional information that's made available to us is very, very helpful. So thank you so much. I'm sure there'll be opportunities for those of you that are listening to participate even more in this process. And so as we talk about what's available, we still want to remind everyone every week, we wanted to remind you about the opportunities that the health department offers to help us to address these issues, to stay vaccinated, to know where the vaccinations are. And I know we've talked about this many times, but we always want to make sure that we bring this information forward every week in case there are some changes. So we have Matt with us here today. And I'm sorry, not Matt. We have the health department here with us today that's going to share this information.
I think I can take this. So I think Joanne's on too, but these are just a list of our vaccination sites for the remaining parts of August. As you can see, mainly on Mondays and Tuesdays and Thursdays, and we have every other Wednesday as well in there. So this is our COVID-19 vaccination sites. And then we also have a list of testing sites up on here. We have Word of Life Church Tuesday and Thursday from 12 to 6. We have Bethel United Methodist on Tuesdays and Wednesdays from 10 to 4 and Thursdays from 1 to 7 p.m., as well as Macedonia Baptist Church Monday, Friday, and Saturday from 10 to 3 p.m. And then other testing and vaccination sites that are outside of the health department: Walgreens daily 9 to 5. You can choose the type of test you want, PCR, antigen, right on their website. There's also Hamilton Community Health Network. So they're scheduled every 10 minutes on Tuesdays and Thursdays, both at the North Point Clinic and at the Burton Fire Station. And then lastly, we have that Schwartz Creek Sunday through Saturday, 9 a.m. to 5 p.m. And then Flint Rite Aid Monday through Friday, 10 a.m. to 8 p.m. and Saturdays through Sundays, 10 to 5. And that's the Rite Aids, both in Schwartz Creek and Flint. And then for additional support, if you know someone who's unable to access the website or internet, needs help with COVID-19 scheduling, they can call our COVID-19 call center for help. And then we also have information available in English and in Spanish. And if you or someone you know is unable to leave their residence due to health conditions, but would like to receive the COVID-19 vaccine, we ask that you please complete the questions found at the link on our website, which is www.gchd.us/vaccine scheduler. And then, as always, you can find more information on our website www.gchd.us.
Thank you, Danielle. And I always also see Joanne Herman. Joanne's out about it a lot. And I see Dr. Gordon. Many times there's some additional activities that are going on in the community. And so Joanne, did you have any additional insights that you wanted to add? And then I'll offer an opportunity to Dr. Gordon.
Yes, thank you, Yvonne. I would just add that at our Genesee County Health Department events, we do offer vaccines for children 6 months of age and older. We're doing first, second, third if they're immunocompromised, and the first and second booster at our event. So I would just encourage people to spread the word, and we'd love to see more people at our events.
Thank you. Dr. Gordon.
Hi, good afternoon. We will be having a vaccine event at Hasselbring today from 4 p.m. to 6 p.m. Also next week on the 16th, we'll be at Davison's Farmers Market every other Tuesday from the hours of 1 p.m. to 3 p.m. offering COVID-19 vaccines for 12 and up, all three, Moderna, Pfizer, and J&J.
Thank you. And I'm also going to ask Jim Melanowski, there's an event coming up. It's a few weeks away, but looking at an opportunity to provide more vaccines for our community.
Well, hi, Yvonne. Yeah, it's actually coming up sooner than you think. September 9th. We thought we'd start the flu season a little early so that people can get a flu shot. And it's our annual drive-through event that we have at the health plan where people, it's so convenient. People can just drive into one of our garage bays, roll down their sleeve, and a pharmacist will give them their flu shot. And we plan on having partners there that can give COVID vaccines and boosters and all other vaccines that we can have there. And so we're looking forward to it. So more to come on that, and we'll get some more details out as the time comes near.
Thank you, Jim. And there is a question in the queue. I want to go back. I think this question would be for, for Danielle, because you talked about the vaccination and the boosters. And the question is, I've already been vaccinated, William Dobb. I've already been vaccinated with Moderna. It looks like 3 times. Do you need to get vaccinated and when? And I think you touched on that a little bit. So just to be clear, if you could respond to that again.
Yeah, so Joanne can also jump in on this. So it just depends on what your age is. If you're over 50, there is a recommendation, or if you have immunocompromising conditions, you can get a 4th booster. So that's or the 4th dose will be available in September-ish, hopefully. So planning on that. And additionally, if you haven't gotten you said Moderna ×3. So yeah, it just depends. Just covering back those slides. If you're under 50, you can kind of wait around. If you're over 50, you haven't gotten that 3rd dose, we'd recommend getting the 3rd dose. Looks like you did. So I guess just waiting to see until fall is also an option for you, because there might be a 4th booster available.
Thank you so much. Thank you so much. And I think we've got one other question in here. Okay, I think we've got them all those questions answered. So we want to now look at our data. We have Rick Sadler, who is going to help us look at data now that we've looked at all of the opportunities we have for vaccinations. And we're encouraging everybody to please follow those other protocols. And we may have a quick moment to get back to that before our webinar ends today. But we want to hear from Rick Sadler, who will give us some information on our data.
Sure. So a couple of quick points this week. One is we're digging into recent vaccinations, and we should have some information for you by next week. It's a little fuzzy with the data that we have at hand, looking at who is getting vaccinated in the last, say, 4 or 5, 6 months. But what we're going to be trying to do is looking at neighborhood level changes in vaccination rates, and then looking at the characteristics of those neighborhoods. And that might give us a little bit of additional information as to who is getting vaccinated more recently or boosted more recently. With respect to our case counts regionally, kind of about the same. We're still in better shape than the Southeast. Most states in the Southeast are the leaders in case counts, hospitalizations, and deaths in the last month or 2. The Northeast and out West are a little bit lower than Michigan, but we're doing fairly well in grand scheme of things. And we saw decreases in Genesee County and Flint this week over last week, still a little bit higher than the couple of weeks before. Our positivity rate, of course, is still pretty high. And as we know, there's reasons for that. People aren't getting tested, or they're only getting tested if they're symptomatic, or I guess more frequently. And yeah, so that's my quick update for this week.
Thank you, Dr. Sattler. Appreciate that update. And now we want to just, today we have, for the first time being with us, is our new public health manager for the city of Flint. And we want to invite Faith Grossbeck to be with us. And Faith, just want to have a little quick conversation with you. We were excited to talk the other day that this is your first time being on here live with us. And so I wanted to ask you just to give us a good sense of why it's important for us to have a public health department or office of public health in the city of Flint.
Well, thanks, Yvonne, for having me. I'm so happy to be here. I've really enjoyed all the speakers today. So much good information, enthusiasm, and perspective here. So today I would like to, share some information about what's going on in the city that affects public health. And as you all know, mostly researchers and providers here, equity is at the core of public health work. So that means providing extra for the people who need it most. So my role here is to help make that happen for the people in Flint.
And so one of the important things that we talked about too is that there are some critical things that are happening right now. We've had overtime, and there's a couple of really important points that we wanted to bring out today. And a lot of people have had questions about the use of the funds in order to improve the lead service line replacement. And I know you were going to bring us up to speed on that.
Well, in the city council meeting that happened this week, they voted and approved a contract. The contract is with Lakeshore Global Corporation. So they're going to continue the lead service line replacement in Flint. They don't have an exact date yet, but they did say they intend to begin with restorations. So that means repairing sidewalks and planting grass where lines have already been replaced. And then they're going to perform an assessment. And after that, they're going to resume replacing the lead service lines. Residents can assist in getting this work completed by allowing them access to their home if someone from Lakeshore Global reaches out to them to schedule an appointment.
And so we're still waiting on the exact date for that to get started.
Hopefully soon.
And make sure it tells that. The other thing we talked about was a home repair.
Mm-hmm. So although residents cannot apply directly to the city for ARPA funds, we realize that having safe, affordable housing is an important public health issue. So there are resources that are available to residents that they might not be aware of, including the lead-based paint hazard control program. So to check and see if you're eligible for this program, you can call the program manager, Mykesha Loring. Her number here is 810-237-2004. She's also the president of the Community Housing Resources Board, which hosts an annual resource event every spring. So the dates and locations for the 2023 resource event have not been determined, but if there are additional resources that become available between now and then, information will be available at that event. So please stay tuned.
Thank you. And I forgot to ask you, if you bring a wealth of information, a wealth of background with you to this position, and maybe some of the community members have not heard about that experience that you bring to this table.
Well, I have been working in public health since I was a teen. I volunteered in New York City on Staten Island at the height of the AIDS epidemic. So those were my earliest experiences in public health before I even knew what public health was. I went back to New York City and got my bachelor's degree there at City University of New York, Queens College. And while I was there, I worked as a health educator. I developed health education programs at homeless shelters and high school. I worked in contract compliance and quality improvement. I also got my certification to be a childbirth educator. And I volunteered for organizations like the Women in Prison Project at the New York Correctional Association to help ban the practice of shackling people during childbirth. When I moved back to Michigan, I worked in public health surveillance for the Muskegon County Health Department in perinatal loss. And I was a doula and childbirth educator for 5 years and running my own business. After that, I went back and got my master's in public health at the University of Michigan here in Flint. And then I worked for the state for a while as a COVID case investigator.
So we're going to look forward, Faith, to your engagement in community. Look forward to the opportunities that we have to share with you some of the thoughts of community and even the concerns of community as we move forward. And certainly, we are sure you're going to have some conversations with community about what communities are based upon your background. So we certainly appreciate you joining us today, and we look forward to having you join us in the future.
Thank you so much. I appreciate all of the information and help people have already provided me. So thank you so much for all that you have assisted me with so far.
Thank you so much. And now we're going to bring Dr. Susan Wolford back. She's going to talk a little bit about upcoming event.
Thanks so much, Yvonne. Yes, so as we've mentioned on previous webinars, coming up on September 30th is the HFRCC annual symposium. And so we are really grateful to everyone who has submitted their abstracts. And we have a number of excellent abstracts that are going to be presented as posters and some orals at the symposium on September 30th. I hope by now you've marked it in your calendar, because as you know, we want to bring inspiration to you through all of these different presentations and a fabulous keynote speaker and information about all of the science that's going on in Flint. And we also want to promote interconnection, so there'll be networking opportunities. Now, we have opened the registration, and so if you go to the link, you will be able to register. So please do that early so that we can plan ahead. We also have opened, and I mentioned this last week, but I want to reiterate it this week, that we would like you to nominate people who you think have contributed to improving health in Flint for an award. We have awards for those who've worked in Flint for many, many years, those who are early in their career. For partnerships, we want to recognize both academics and community members. So please go online to the link that has been put in the chat and do a couple of things. First, register so that we know that you'll be coming, and 2, nominate people for those awards. Thanks so much, Yvonne, for allowing me to share again about this. In fact, I just want to share about it every week between now and then, because it is our very big, exciting event for the year. And certainly, if you like the information that we present on the webinar, you're going to love the symposium.
Now, one of the things, Dr. Wolford, since you are here, there was a question, and I think that others might, I think you were answering it, but I think others might want to know as well. And the question is, by Dr. Gary Johnson, has anyone heard of any racial disparities with monkeypox?
Do you know, I think that's such an excellent question. Of course, the data that we have right now is very, very early. And so it speaks to the comments that we've made all the way along, that we learn week by week, day by day, often moment by moment. So the information that we share now might well change over time. But there does appear from the earliest data, data from end of June, I think around June 22nd, data came out from the CDC, and it appeared from those data that the cases of monkeypox, there were about 2,800, just over 2,800 cases. And there was a disproportionately high percentage of Black and Hispanic people who were getting monkeypox compared to the numbers of our populations within America. So, for example, Black residents in the US make up about 13% of the population, and about 26% of the cases of monkeypox that were reported by the end of July. I will add two caveats to that. First, the numbers have gone up exponentially since then. And so we're now at, I think, yesterday, I believe, the data suggested that there were 10,000 cases of monkeypox. So huge changes in the numbers. And two, when they were reporting on the disparities, most of the cases didn't have any demographic information included. So it just, again, highlights the importance of public health and how each one of us is important to that. So if you are ever getting tested for anything, please, and they don't ask you about your demographic information, offer it so that we can be sure that these information, these data are available, and that we'll be able to speak to the resources that are needed and the disparities that are being experienced, because we'll have those data.
Thank you so much, Dr. Wolford, for sharing that. I was just trying to check and see. I wanted to just loop back to Dr. Reynolds just quickly, because Dr. Reynolds, you always share with us those layers of protection. But if you could just give us a quick overview. I know you're just kind of chomping at the bit on this one.
Well,
with all the things that are going on, I mean, we've started this webinar looking at coronavirus, but we see that it's truly expanded to just overall health and well-being. And so I'm going to just give you this opportunity to wrap this up for us today.
and thank you for the opportunity. The layers of protection are basic tools that most of us can practice at least half of them, and then we work in concert with our health department to practice those other layers of protection. And they're tools because no tool is exact for every single job. And like the Swiss cheese that I always show, there are areas where you need another layer of protection. And that's it. So that's why we say under personal responsibility, wash your hands, wear your mask, avoid crowds, have good ventilation where you are. And remember, there are people around you who may be immunocompromised or immunosuppressed because of a disease or because of a treatment, and we must protect them. Then there's the shared responsibility, and that's the vaccine. Vaccination is still the foundation for prevention of damage from infection. And I've had to back off on that a little because this coronavirus mutates so much, but that's why we have this huge research component, Center for Disease Control, and those labs that are always testing the efficacy of their vaccine and effectiveness of their vaccine in stopping serious problems from infection. Then messaging, and we just heard the speaking about credible sources. That's the shared responsibility, that we have credible sources from our governments that will give us information about what we have to deal with. Okay, and then there's things like improving the ventilation in public buildings. So all those things are layers of protection. And I forgot the most important layer, and that is when you hear the right thing, remember it and use your brain. And like Mama used to say, just because you see your friends jump off the bridge, are you going to jump off with them? I'm done.
Thank you so much, Dr. Reynolds. And that really brings us to why We've said this webinar is so important because for those of you that are listening, that are sharing this with other community members who may not actually be on the webinar right now, your voice is important. You are one of those credible, trusted individuals. Someone is paying attention to the information that you share. And so we want to continue to encourage you. For those of you who are social workers and community health workers, please remember to stay on following the webinar and apply for those social work credits and apply for those continuing education units so that you can get credit for that. But also we thank you for taking the opportunity to get the information that you need, that you can help us share with our community, because it is so incredibly important that our community members are learning and getting their question answered. Everybody may not do the same thing, but as Dr. Reynolds said, we all can do something. So we're going to ask you to continue to like us on Facebook, subscribe to our YouTube channel, Healthy Flint, and of course, email us at any time at info@hfrcc.org to ask those questions so we can continue to answer those, and give us a call at 810-835-2130. We thank you for joining us today and look forward to having you join us again next week. Thank you again for today.